A stroke is said to occur when a part of the brain stops receiving adequate blood supply and therefore nutrients to that part of the brain. There are essentially two types of stroke. Stroke that occurs because of a blood clot, or stroke that occurs because of there's bleeding in the brain. In either of these strokes, what happens is that there is a cessation of blood supply to a particular part of the brain. The brain, as you know, is responsible for supporting all organ functions. It is responsible for you to move your hands, for you to see, for you to talk. Therefore, if you have cessation of blood supply to any part of this brain involved in any of these functions, it will result in the loss of function of that part of the body. When you have a stroke, because of this cessation of blood supply that I talked about, that part of the brain dies. Especially if you do not arrive in a hospital that is able to treat that stroke urgently. When it dies, you lose body function, which may manifest in loss of vision, difficulty in speaking or understanding what people are saying, weakness in the hands or the legs. Or sometimes, if the stroke is fatal, it can actually result in death very quickly. Like I said earlier on, because the brain controls most of our body functions, when you lose function of a particular part of the brain, it can result or manifest in loss of body function. There's a mnemonic we use for this, which is FAST, F-A-S-T. The F in it means facial droop. The patient's face can droop to one side. The A in it means arm weakness, which can involve loss of strength in the arm or in the leg on one side or both sides. The S in it refers to loss of speech, which can manifest in the person's inability to speak well or even understand what people are saying. And finally, the T in it refers that it's time for you to act fast, because we know that time is brain. The general recommendation is that if you are having a stroke or you know somebody who is having a stroke, it is important to get to a hospital that is skilled in the treatment of stroke. These hospitals, if you get to them on time, can be able to assess the patient and be able to also provide a medication that can, in the case of the blood clot, if it is the result of the stroke, when given this medication, which is called a clot buster, it can dissolve that clot and the patient can regain body function fast.
Some victims are unable to identify their stroke symptoms because they may seem helpless, they may be confused, and then they are unable to help themselves. So it's important that someone standing by identifies such symptoms and try to help them get help as soon as possible. First, you have to first identify that stroke is an emergency. So if you think someone is having a stroke, the person will need emergency medical care. So going to the hospital as soon as possible is very important, because when you get to the hospital, the chances of survival is increased and the risk of mortality and increased morbidity is also reduced when you seek urgent medical help.
Yeah, stroke is a debilitating disease that comes in with several disabilities. A common side effect or common outcome of stroke is paralysis. It means you can't use a part of your body after you've experienced stroke. It's a problem that has economic and several other consequences. Very close to it is weakness of one side of the body, but those are not the only problems, because stroke affects the entire body, the mind, the psychology, and also possibly the finances. Some people may have memory problems, speech, sometimes they may even get depressed. These are all outcomes of stroke. They could be mild, moderate, sometimes even severe. But we are hoping that people that get very good care can have a better outcome. The risk factors for stroke means things that can make you likely have stroke can either be modifiable or non-modifiable. And it's very important for us in the developing world to know this, especially the fact that we do not have health insurance or primary care. When you get older, your age is a common risk factor. The fact about blacks, hypertension, these are non-modifiable. You cannot modify your age or your race. But your body weight, cholesterol level, your sugar level, ensuring that you exercise, you move around a bit, are things that can be modified. So some of them you may require a medical personnel to help you find out what they are. Others are what you can do at home, such as physical exercises and good diets. And this could help you reduce your risk of having stroke.
It is important to get to the hospital as quickly as possible after a stroke, because there is a drug called TPA, tissue plasminogen activator, that is used in the early management of stroke. It's also known as the golden hour in the management of stroke. When you get or report to the hospital as soon as possible, within the first 3 hours of the stroke, it will avail the hospital enough time to do a CT scan to rule out if there is a bleeding or not, and also provide you the opportunity to use this medication. Why it is important also to use this medication is that it has a 30% chance to improve the outcome of the stroke, because most strokes that happen are ischemic strokes. So it is important to get to the hospital early. Risk factors of stroke actually can be classified into two broad perspectives, which are the modifiable and the non-modifiable risk factors. The non-modifiable risk factors being the ones that you can't change, like you can change your race, being black, you can change the fact that you're a male, and you can also change the fact that you are African. But the modifiable risk factors like smoking, obesity, diabetes, hypertension, those ones actually can be modified. So for the ones that are the modifiable ones, it is important to work on them and keep them so that the patient will be within their most optimal state. Treatment of stroke can actually be classified into three major parts, which is the prevention strategy, the therapy immediately after stroke, and the post-stroke rehabilitation therapy. So the treatments immediately after, the prevention treatments include the use of antithrombotics like the aspirin, the clopidogrel, the new oral anticoagulants in the prevention, while the therapy for stroke is goal-directed, where you have to identify the cause of the stroke and manage it. There are several things that can actually predispose a patient to having stroke, like maybe heart diseases where the person has maybe an atrial fibrillation. So you have to treat those things and get the patient to the point where they have to begin to get rehabilitation. If it is also from bleeding, you have to treat the patient, keep the blood pressure within a limit where the bleeding and hematoma expansion risk will be reduced. Well, if you get to the point of rehabilitating the patient, you do your rehabilitation, especially post-stroke rehabilitation of patients is very important, because it's not just about treating the patient in the hospital, there is also a life after stroke have happened. So post-stroke management is very vital to stroke care.